Good morning, everyone. Part 2, Intel Fixator, plates. The plates, as I saw in the previous video about the screws, plates are protected by bone. Plates enhance the function of screws in order to heal up the fractured bone in a faster manner. So, functionally, plates can be characterized as neutralization plate, compression plate, buttress plate, and bridge plate. Coming down to first one, you can see the neutralization plate, right? So if this is a fractured part, you can see that red line. You can see here the malleolar fracture. What happens in this fracture is you need to hold this bone, this fractured part of the bone back to the parent bone. So functions of neutralizing plate is conjunction with the interfragmentary screw fixation. Even if you fix a screw through the fracture, you can see that the malleolar part, you're fixing the screw through the fracture to the bone because the circumference of the bone and the fractured bone is very small. It will not hold up together. Thus, what we are doing is we are just enhancing the function of the screw by adding up a plate. This neutralizing plate neutralizes the torsional bending and shear forces. Very important. It neutralizes torsional bending and shear forces. Looking at the compression plate, the next one, compression plate functions to negates the torsional bending and shear forces again by creating compression across the fracture site. It enhances the healing. So if this is one screw, this is one screw, what will happen is if you place a plate over here, you're just going to compress it from either side. You can see that this is a fracture. If you induce a compression from either side, it will just get compressed. As we are speaking repeatedly, compression is very important in enhancing the osteoblastic activity, thus leading to healing of the fracture. So compression plating is the function of using the compression in healing of the bone, fractured bone. The other two types are buttress plating and bridge plating. Buttress plating negates again compression and shear forces that occur with metaphyseal and epiphyseal fracture. It's frequently used in these fractures, frequently used in conjunction with interfragmentary screw fixation, just like your neutralizing plate. Now, bridge plating is used to span comminuted unstable fracture or bony defect in which anatomical reduction and rigid stability of fracture cannot be restored by fracture reduction. If just remember, if it is comminuted and unstable fracture, definitely bridge plating is used. I think this is the last one, locking plate. Locking plate is nothing but hybrid of plate technology and percutaneous bridge plating using screws as a fixed angle device. In locking plate system, you can see that the screws are angulated as well, not only straight. Whereas here, the screws of the plate were just straight. So this is major difference between locking plate and neutralizing plate. People usually get confused here. The screws are angulated in locking plate system. Hybrid fashion with locked and unlocked screws. You can either lock it or unlock it. Unilocking is also possible. Provide adequate load bearing strength to avoid medial and lateral plating in distal femur and proximal tibia and tibial plateau. The last part, tension band wiring, very important. Tension band wiring is usually done for patellar comminuted fracture and olecranon process comminuted fracture. These are the frequently seen fracture where TBW is done, tension band wiring is done. A form of internal fixator which converts the distraction forces, that is the pulling apart forces, into a compressive forces, thus beneficial for healing process of the fracture bone. Usually, this is used in stellate fracture, a common fracture seen in patella and olecranon process. Complication. Tension band wiring complication are PGA, septic inflammation and sinus tract formation, osteolysis and severe synovitis. The factors affecting the biomechanical properties of bioabsorbable polymers are chemical composition, manufacturing process, physical dimensions, environmental and time. Now, time is very important in internal fixator. Time of metal removal. These are frequently asked in orthopedic and traumatology paper. Malleolar bone fracture. If you do the implant, internal fixation, then 8 to 12 months, after 8 to 12 months of implantation, it can be removed. Tibial pylon, 12 to 18 months. Tibial shaft plate or tibial shaft plate, 12 to 18 months. IM nailing of tibia, 18 to 24 months. Tibial head, 12 to 18 months. Patellar tension band wiring, 8 to 12 months. Femoral condyles, 12 to 24 months. Femoral plates, single plate is 24 to 36 because it needs a lot of stability. We cannot remove it within that. But double plate system can be removed from 18 months. In step 2, we can remove the other plate after an interval of 6 months. IM nailing of femur can be removed, should be removed at least after 24 to 36 months. Before that, not possible. Peritrochanteric and femoral neck fracture, plating or screwing for that can be removed after 12 to 18 months. Pelvis, only in case of complaints, it should be removed from 10th month onwards. Upper extremity, which is optional, we usually don't remove it. If it is needed, then 12 to 18 months. Thank you so much. We'll meet you in the excellent fixator class. Thank you. Have a great day.